Welcome to our discussion about application of TinniTest. And first, welcome Dr. John Moulton. And can you introduce yourself?
Sure. My name is Dr. John Moulton. I got my degree, my master's at Lamar University, Beaumont, Texas, which is exactly the same university that Dr. Tao got his from. Later on, probably maybe 4 or 5 years later, I went back to college, you could say, and got my AUD from Arizona School of Health Sciences, which is actually, again, the same university that Dr. Tao got his from. I practice audiology probably 10 years now. I don't know, I'm getting older, so the years are confusing me. But I've done everything from hearing aids to balance to geriatrics to children, full scale is what I've done. Worked in pretty much all over Texas, pretty much in my local. I've also worked in Thailand for several years, and now I'm jumping.
Welcome to the DSP. Tao Jiang, I'm also an audiologist, graduated from the same university as Dr. Moulton did, and I got 2 master's degrees. One is audiology, the other is deaf education. After that, I practiced for 10-15 years in the States and Canada, and I got my AUD also from the same program in Arizona, but that's called the Steele University.
ATSU.
That's right. Then I traveled between China and the US, Canada, and practice audiology and promote audiology in these countries. And then we established micro DSP back in 1999. The company essentially provides manufacturing research based on the digital applications, from hearing aids to speech correction devices. But Tinnitus is one of the things we're doing now. And also welcome John actually joined our DSP, and currently we're also working on another very exciting project, but we'll discuss in different occasion. So what we do today is that we'll talk about TinniTest. This is a revolutionary, very innovative audiological equipment we're using to test tinnitus. So we're going to talk about why is that unique and how we use that. So,
Well, my question, well, I have several questions, but one of them, I think it was maybe 4 years ago, maybe 5 years ago, we were at AAA and you were talking about this machine. So I was just wondering how many years of development was this?
that's a good question. Yes, I think about 4 or 5 years we start talking about that. I think back in 2000, in fact it's a little longer, 2007, we start doing research about how we can develop instruments to measure tinnitus and also provide more effective treatments. So to answer your question, it took us quite a while. We have done a lot of research, both from publications, different experiments. Also, we spend a lot of time on engineering points. Again, we need to find a device, instruments, which can do this job. We need to create a more advanced digital platform. Way back a few years ago was an analog technology for the instruments, so we decided to move to a digital platform to create this device.
What is it exactly the TinniTest does? It seems to me that it has the ability to pinpoint the actual frequency, things of that nature.
Yeah, I think that's a good question. I mean, first, the name of TinniTest, people get confused with the tinnitus. Tinnitus is the name for the disorder where patient will experience ringing ears without any external stimulation. Where a TinniTest is a word we coined to reflect 2 things. First of all, it's a test machine. That's why it's a test. But the test machine is to measure assess tinnitus. That's why we create this word TinniTest. Means that essentially is a sophisticated instrument to measure tinnitus. Now, back to your question, how do we do, or what are we going to do with the TinniTest? Basically, there are two things we can do with the TinniTest. Like any other instruments on the market, TinniTest can do two things. One, it can provide a comprehensive tinnitus evaluation, which we'll discuss later on. You will measure psychoacoustically the patient's responses and different characteristics of tinnitus in the patients. We will measure that. So that's the first thing tinnitus can do. Now the second thing, of course, based upon the test results, TinniTest can also provide a different treatment approaches. One of them, of course, is use the sound therapy to treat these patients. Now, as you can see that, we put two functions in one system to measure and to treat or manage. This is something when we first started with this project, we didn't see this kind of application in the market. You need to measure, and also based on the measurements, you do the treatment very accurately and also based on the individual results. So that's what tinnitus can provide and do in a general term.
Let's talk about that for a moment. You were talking about the treatment portion. Back in the days when I used to work with hearing aid patients a lot, and a lot of them complaining of tinnitus, and we were very limited on what we could do. Most of the time I just put hearing aids on, and I didn't really worry about trying to mask because we couldn't really pinpoint the actual tinnitus itself. So it was just kind of a broadband thing, and so it seemed like it would be deleterious to someone's hearing ability because you're just masking over everything. But your product actually pinpoints and does a frequency range.
Yeah.
That's pretty nice.
Well, you're right. I think if you look at previous, even current tinnitus individual treatment devices, we can summarize about from very early white noise generator, on the market, to the latest now summer instruments. They can shape the music as a stimulus, as a signal, to provide audiogram-based treatment to the tinnitus patients. But the signal is using music. Also, for the last 20 years, we heard there's a model, and we call the TRT. It's a tinnitus training and therapy created by Dr. Jasperchoff. They also use some signals to treat the patients. Unlike a masking approach, they use low-level signals to treat patients. But anyway, so we look at the market, there are probably about 20, 30 different kinds of devices. They will do different things as we explained to you. But unlike anything else, our device, we call the e-masker, and you can see we have a sample here. Unlike any other devices, the e-masker first is a digital device, and this is a medical device. And this device will be able to hook up with the TinniTest, the machine. So what it can do is two things. One thing is we can make it very individualized. Any test results through the TinniTest will be digitally downloaded into this device. Let's see, we find there is a synthesizer signal which is very effective to treat a patient. And through testing, so we're able to download exactly the same signal to the device. So a patient can take this home, use it on a daily basis. For most devices, they are not able to do that.
When you say they use it on a daily basis, do they use it for several hours, or how does that work?
That's a good question. I think depending upon the patient responses, the measurements, and the patient's lifestyles, also patient individual tinnitus problems. For example, some patients have tinnitus before they sleep. Some patients have tinnitus maybe a lot worse through serving their jobs. Or some patients, they just complain tinnitus in general. So depending on different situations and according to the assessments, also according to the doctors, audiologist recommendations, so we will be able to provide a certain time patients can use that. But again, back to the question you asked about it, as I said, it's different from other devices. The first thing, as I said, is that digitally you can download any signals you find that clinically effective. You can download this digitally right into the device. We haven't seen any device in the market and they are able to do that. But second most important thing, unlike in any other devices, this device is not only a passive sound generator, but also we call this as active participants in the whole tinnitus treatment program. By that I mean this device is the first one. It has we call the validation, or we have a questionnaire built in the device. So before patient use it, they can punch the key. Very simple, just a 6-level questions. Is tinnitus annoying you? How much? So patient will punch the key and to say, okay, let's say I think tinnitus is very bad. So number 5, you punch on that. After treatment, patient will go back to punch another key, asking the patient, how do you feel about the treatment? Do you feel the tinnitus is the same or better? Patient will click another key there. So by comparing the responses before and after treatment, patient will be able to see that.
It's kind of a self-evaluation.
It's a self-evaluation. It's an evaluation, but it's a validation. It's a questionnaire. We are, as audiologists, nowadays we use a lot. We use AFAB for hearing aids. This is a questionnaire that we call a noise scales. Tinnitus noise scale. It's a 6-level scale of questions. So we built that questionnaire into device. The patients able to, and patient, not only patient but also audiologists, are able to interact with the patients by using the device, and we'll be able to find out whether the device is working or not working. So this is a significant departure from what we have been doing traditionally, which is based on the patient's responses. I feel better or I don't feel better, I'm okay. But this is a more, clinically proved the device is working, provides, the effective treatment. So again, that's why this device is very different from any other devices in the treatment.
You talked about you have several different products. I'm just curious, do you have one ear level, or are they all pocket style?
Yes, we do, and we also have this is a CD, and this is CD can also use as a media instruments or whatever. This CD can also be put into the device, and in TinniTest, you can record very effective signals as we showed you together to the CD. Instead of to the e-masker, you can put in the CD, so people can bring the CD back, they can listen, use their CD player. So that's essentially the same thing as that. And also we have a hearing aid, we call it combination hearing aids and the masker. It's a BT, CIC, ITE, it's a full spectrum, wide range of hearing aids with masker capability. But different from the older days. Remember, older days is just tinnitus masker. You turn on, give you just white noise. This new device is different. Well, we have 3 programs or 5 programs. We can make as many programs as we can. You push program 1, it's a hearing aid. We know that 80% of tinnitus patients, they have hearing problems. So you can push program 1, that's a hearing aid. You push program 2, that's a preset white noise, which is white band noise. Or you push program 3, that will be tailor-made narrow band noise. And in the future, if you push the program forward, we may have other kinds of signals which will be effective to help the patient. So the tiny hearing aid will become a portable masker, sound treats, generator, and a device people can use on a daily basis. So again, I think the main difference with our devices from other market devices is that we always emphasize every one of them has to be individualized. It has to be based upon the testing results. So then we'll talk about TinniTest as a machine, and what actually we can do. And I think you have seen this machine before, and we showed you before. Again, as I said, in the US now, and since 2005, AAA, American Academy of Audiology, releases a position statement about tinnitus. Essentially,
Tinnitus or the test question?
But I think when I say tinnitus is tinnitus.
Okay.
Let me use American American pronunciation, tinnitus. You use tinnitus.
Tinnitus. Right.
Okay, let's see. So since 2005, AAA launched its position statement about tinnitus evaluation treatment guidelines. In that guideline, clearly states two things. Of course, a number of things you have to do, but that guideline requires any tinnitus management or treatments or rehabilitation, whatever services you provide, you will have to evaluate the patient first. Right. And it clearly states what you do, and you have to pitch matching, loudness matching, so on and so forth. So that's the criteria currently I think we needed to do. But not only American, I think if you look at European, let's say German ENT Association, they also require any tinnitus treatments before you have to do evaluation. So the question right now, as a reality, you've seen that most of the treatments we do, we only do a few things, just quick pitch matching, loudness matching. Then we rush to provide treatment. But that's not enough. Now, when we say tinnitus evaluation, in fact, we mean there is a protocol and consisting of a full spectrum of psychoacoustic measures of the tinnitus. I think traditionally we call them the 5 things needed to evaluate. Of course, we have to evaluate pitch matching, loudness matching. We have to measure what we call the minimum masking curve. Sometimes we call that MML. You want to find out what is minimum level you need to mask the patients. Then we needed to find out different configurations of the masking curves. Now, European, they call that the Feldman curves. It's a German ENT who described this first. Then, 5th thing, I think is the thing we want to do is called the residual inhibition. I think this is discovered and all maybe validated by Dr. Jack Vernon and Oregon Centrally. I think of course, there's other thing as well, but there's 5 key measurements we believe are very important. They can provide a more accurate picture of tinnitus of the patients. They can give you more information about how you will be able to treat. For example, we know that there's a small portion of tinnitus patients. They react to external sounds negatively, meaning if you put an external signal, either masking or low level of stimulation, patient actually reacts negatively.
Meaning it gets worse.
It's getting worse. And we know that some patients, for example, if you find out some hyperacusis, some patients, they just react, you will not be able to provide treatment, make it worse. So there's 5 things we needed to do in order to identify the exact characteristics of tinnitus of the patient. Then you can plan the treatment based on the test results. So that's the philosophy behind TinniTest, the machine we want to do that. Now, we were talking about it a while ago. You asked me, we have all the audiometers now. They can do nearly almost everything. Why do we need TinniTest, to do those things? I know when I studied audiology, we use GSI system to test almost everything we can, and of course now we use different machines now. But essentially it's the same thing. Now, I don't think there's a problem with the audiometers, but audiometers, I have to say that the present audiometers, I think they are built on a framework, I believe it was 40, 50 years old. They build upon a structure and manual work, and they build on a traditional testing procedure which we did many years ago, start doing that. Even though the new audiometers, they look nice, fancy, but fundamentally we believe, correct me, I think I'm wrong, but I think fundamentally we still think the whole audiometer, you still have to do the same thing. Recently, that's just a different story. There's quite a bit of research in the US about the current audiometers are not able to help us to test as many patients as we wanted. Problem with the audiometer. But back to tinnitus, the traditional audiometers, their frequency interval is very wide. We know older audiometers, we have at most 1/3 octave bands. It's not for all, it's only for a few. We test 250, 500 hertz, 1000, maybe 1500, 2K, 3K, 4K, 6K, and 8K. The problem is when you have a very wide frequency range, and some tinnitus, they have a tinnitus is very refined and they're very precise. We see some patients have a tinnitus anywhere from, let's say, 3,500, 500 hertz. With current audiometers, we're not able to do the match. No, we're not able to. The intensity level and the frequency interval are just not small enough or accurate enough allow you to do those things. So that's a problem with our audiometers. But the second problem with those, I call that audiometer approach, is that everything you do, you have to pull up different resources to do things together. Remember the first time when we are audiologists, we start doing the, let's say, tone decay. We need a stopwatch. Right. We need someone standing by, write down on paper, and I have to use another extra hand to dial the different frequencies. Then I have to keep my eyes looking at the patient to find out whether my patient raises a hand or not. Yeah. So that's exactly the same example here. But imagine, for example, when you do residual inhibition with the current audiometer, you need three things. You need a stopwatch, because as soon as you stop that residual inhibition, you have to measure whether tinnitus goes down, stays the same, but you have to measure with your stopwatch. Then you have to write down, you have to talk to the patient. Then the problem is, where do you put the results? All the results, piece of paper. You have to write down how you do it, what you find out through the testing. So with current audiometer, we're not able to do all those five major tinnitus measures clearly, coherently, easily, and properly. So that's where we have to create a machine, and TinniTest, this machine we created, is able to integrate all those 5 tests together. And we will show you, and you can go each one by one, measure, and you can do that. You don't have to write down anything. Everything's on the computer. Everything is recorded. Everything we set up in such a way, and the computer will help you complete that test. So that's a big, I think, improvement compared to traditional audiometry approach.
I already know the answer to this, but let's say I have a GSI 61. I just bought it. I love it.
Okay.
But I still want the TinniTest. What do I do? Do I have to throw away my GSI 61?
Well, that's a good question. I think I think I don't want you to throw anything away. Just put aside with them, and that's a good point. I think you have GSI 16, which is a new version, updated version of 16. It can do a lot of things. It's 2-channel audiometers, and again, I have not seen the GSI 16. One can do what I just described.
No, it cannot. But my point is that isn't it modular? Can I buy just the TinniTest portion, or do I have to get the whole package?
Yeah, I think the answer is no. You can't. I'm sorry. I think it's because GSI 61 represents what we call a closed platform. The meaning that is a company-based platform they created that on. It's not open to be able to be hooked with any other devices.
Oh no, I mean.
So I mean the module, for example, we cannot put a module into that because it operates on its own. What I suggest is that because you actually brought up a very interesting point. TinniTest is not only for assessment of tinnitus, but also TinniTest is a comprehensive audiometer. It's audiometry. And we have about 5-6 different modules in TinniTest. You can do a very detailed patient and interview, case histories, questionnaires. You can write down as many details you want about the patient. That's a case history module. Then we have a full audiometer module. It means that you can do standard pure tone and speech. We can do high frequency, and we can do some fields, which can also be hooked up with the external speakers to the sound field. And then we can do what we call the pediatric testing. We create what we call the VRA module. And this can be hooked up with the displays, and you can show different pictures to do the pediatric testing. So TinniTest is more than just a tinnitus machine. In fact, it's a full audiological evaluation system. That's why when we apply for the FDA approval, its full name is Audiologic Tinnitus Evaluation System. It means that we can, the first, most important thing is audiological evaluation. Also, another thing, the other module is also has a module for retrocochlear measures inside. We also program CC, tone decay, ABLB, MBLB, all those traditional retrocochlear product that we also build in the system. And what we show you, unlike any other audiometers in the market even today, you do those older style retrocochlear battery, everything, unlike CC, you may see some little graphs on that, but most things you do, you don't have clear graph recording. For example, stinger test, you just read the numbers. And tone decay with some other impedance, you can measure that decay with acoustic decay. But when you do audiometer, some has two, but with the CC, with the APLB, with some we call the bone conduction, the tunifocal battery, we can record everything in numbers, but also in graphs. So it's easier for audiologists to use.
Backing up to what I was going to say though, so if I was to purchase this, but I already have a GSI 61, can I just buy the TinniTest portion, or do I have to buy the whole package?
Yes, I think, I'm sorry, I forgot to address that. Yes, you can buy just for the tinnitus portion.
Yeah.
And you don't need to use something else there. You can use it. But the problem here is that I think the problem is not logistics. It's not hardware. The problem is the user habits. I mean, this may create because someone are used to use the GSI 61 or to the normal standard.
Right?
Yeah, we have everything. Well, I'll show you the hardware. But needed to tinnitus measure and move to something else. But of course, we would like everybody to use the TinniTest to do almost everything they
It's
can.
just not practical. Can be done, but not practical. What you're saying?
Yes, it can be done technically, but we would allow people to buy the system, use it along with any other audiometers they already have, Of course, I think eventually next generation audiology equipment, we believe, from innovation standpoint, we believe in the future, all the audiometric test and measurements or the machines can be digitally connected, integrated, that's right, and then we can use them regardless it's this and that. But that's our hope in the future. I think this probably make our measurement more effective, but also it's make it, the whole thing is more green, because every time you buy the new machine, you have to give up an older one, and you have to create one piece of garbage, which we don't want that.
Now, I think I already know the answer on this one, but if you watch the trend of more and more audiological equipment, you can save the information and put it up on a server and that type of stuff. Does that have this capability?
Yes, I think we have a lot of potentials with the TinniTest, this machine. As you can see, our philosophy of design is that we have hardware which will do all the function tests, but essentially you have to link up with the computer. So with the computer in place, then your computer can be linked up with your server. You can upload, download information to your healthcare agency and to keep record the records, everything. So yes, we were able to do that, and also you can use those to do other data management system as well. By the way, TinniTest also has a very fantastic, we call it dynamic TinniTest data management system. And in fact, in 2012 AAA, we have a paid poster and we will present to discuss how we created this database with TinniTest and how we use this instrument software to analyze, process all the information. Imagine we have TinniTest results. We got hundreds of patients. They may have different tinnitus pitches, different tinnitus loudness, different characteristics. With this tool, we're able to process information. We're able to group them. We're able to look at them individually or as a group. So we are able to find something behind the whole individualized complaints of tinnitus behind it. For example, would the residual patient a good way to measure, or would the residual patient is a good way to reduce tinnitus? So this database give us some power to do that.
I have another question. It's kind of off the wall, but it's on the same subject matter. But I have an MP3 player that has an exterior SMD card.
Yep.
Theoretically, could I use that for my, basically like a pocket?
Yes, I know what you're trying to say is that any other electronic data storage system, are we able to record information? I think the answer is yes, but also the answer is no, is that we do not recommend the users use their personal MP3 or any other digital players to download the information and use that for two reasons. The wrong reason is that we know that individual MP3 players, whatever the digital devices, they have different levels. There's no calibration.
Let's have self-evaluation.
That's right. Well, the thing is, first we have to be careful is that there's no calibration, so we don't know whether the level is too high or is too low. With certain approach of a treatment, you have to really exactly give a prescription for the certain level. So with those individual uncalibrated devices, we're not able to do that. So the first reason. The second reason is that the protection of the patient's privacy is also important. If anybody can just copy and do, that's it's going to be a huge issue. That's the reason if it's a CD, in fact, this is not any CD. This CD we have RFID. We have RFID technology built inside, meaning that this is a technically protected. So with this ID, you're able to download information from TinniTest. So if you get any CD you want to download, you're not able to do that because you don't have an ID. So this will protect the privacy of our patients and also ensure, the device and the treatment will work. So I think we have covered essentially the pretty much the major things about tinnitus. But another thing I want to just very brief mention is that I think it's just the latest survey about the tinnitus population in the US just published.
If we're seeing that raising, actually.
It has become, and I think there's a number of large demographic studies, and there's a lot of study about this tinnitus patient. But this research paper tells us something very alarming, actually, is that we got 30 million US citizens who have tinnitus.
I know that the aging population is getting higher, but now with Iraq and Afghanistan and all these men coming back, I would imagine that tinnitus is a major complaint.
Yes. Noise, whether it's occupation noise, management noise, or recreational noise, essentially it's going to create hearing loss. We know that. So also at the same time, it's going to cause tinnitus to people who are exposed to those. So that's the reason I think we see those trends going more. In fact, the new statistics are really interesting. It's really bad is that the older age group, since between 64 to 84 years old, the prevalence of tinnitus actually goes up to almost about 30%, versus 10% of the general population. So the older people are, the more likely they're going to get tinnitus. So they're going to need to get treated. And also, tinnitus now is become a disabling disorder.
Really?
Yes, and the information tells us that 1 out of 5 Americans, they find that tinnitus actually disabling, affecting their life. And one in every 4 people, they report the tinnitus very loud. So we're talking about a quarter or to 20% of the population, and with the tinnitus, they actually suffer a lot. And by the way, also another thing I want to emphasize that tinnitus now, according to the International Disease Classification, and tinnitus is not just a symptom. Tinnitus is an independent disease. Okay, the international classification system and also gives a specific disease code to tinnitus. So it's not a symptom. It's a disease, very much like any other diseases we know today. Meningitis, mumps, whatever disease we have, that's the same thing. So I think with the rising population, with our environment, we're exposed to noise. I think we see a lot of tinnitus patients, so that's why tinnitus, the treatment and the machine, and I think are very, very important. Okay, I think that we had a very good discussion today. Thank you, John. I think we had a nice time to talk all about things. Thank you very much. And if you have any questions, you can contact us, email us. I think you can either go to our website at www.mapidsp.com, or you can contact our US distributors for more information. Thank you.